Welcome to the Law Institute of Victoria. The war on drugs, is it time for a truce? I guess your answer to this question depends on who you think is winning the war. It does seem clear that authorities are failing to keep illegal drugs from entering Australia. Indeed, there's new evidence that even our most secure facilities, our prisons, can't keep drugs at bay. The National Council on Drugs, the principal advisory body to the federal government on drug and alcohol policy, has just released a report that found that Australian jails are awash with drugs. Efforts to cut supply have been a dismal failure. High walls, searches of prison visitors, drug detention dogs, urine testing, all these expensive measures have failed to stop prisoners taking drugs. So if we can't stop people behind bars from obtaining illicit drugs, what hope is there for the rest of us, the rest of the community? Over the course of 2012, think tank Australia 21 has been leading a campaign to get Australia to have a conversation about drug law reform. Earlier this year, it gathered together 24 prominent, highly respected Australians. This group included former New South Wales Premier, now Federal Foreign Minister Bob Carr, former New South Wales Director of the Office of Public Prosecutions Nicholas Cowdery, and former Head of the Australian Federal Police Mick Palmer. The 24 called on Australia to reopen the national debate around the regulation and the control of drug use. They want us to rethink our tough on drugs approach. This Sunday, Australia 21 will launch a new report titled Alternatives to Prohibition: How We Can Stop Killing and Criminalising Young Australians. This report will look at a number of different things and maybe make a number of different suggestions about where to from here. It also looks at the experience of 4 European countries, 3 of which now focus their resources on health measures rather than on a criminal justice response. To discuss Australia's current policies and possible alternatives, I'm joined by 4 people with enormous knowledge of drugs and their impact. We have Victoria Police Deputy Commissioner Graham Ashton. He's responsible for crime and operations support. Prior to joining Victoria Police in 2009, Graham Ashton was an Assistant Commissioner with the Australian Federal Police. We also have Barrister Greg Barnes. He's a former National President of the Australian Lawyers Alliance. We also have Paul Barratt, Founding Chair and Director of Australia 21. He's a former senior public servant who served as Secretary to the Department of Primary Industries and Energy and to the Department of Defence. And we also have Dr. Alex Wodak, consultant with the Alcohol and Drug Service at St Vincent's Hospital in Sydney. He's also a director of Australia 21. Now, we're going to have a conversation for about 50 minutes, and after that we're going to have time for your questions for about 15 minutes. Alex Wodak, if I can start with you, how big a problem are drugs in Australia? What harms are associated with drug use in this country?
Well, there are about 400 deaths from heroin overdose every year in Australia, and we've had that number for most of this century. Just before the turn of the century, in 1999, 1,116 deaths from heroin overdose occurred in that year. So the numbers come down, but it's still very, very high. And then we really struggle to contain a lot of the infectious diseases that are associated with the sharing of needles and syringes. We manage, but not terribly well with hepatitis C. So there are about 1,000 new HIV infections a year in Australia. Probably about 50 or so of those are in people who inject drugs. And there are something like 10,000 hepatitis C infections a year, new infections a year, that are associated with the sharing of needles and syringes. Then, apart from that, there's something like 1.5 million hospital bed days consumed by treating people with medical conditions associated with drugs. Very difficult to estimate the amount of crime. Depends on definitions and subjective judgments, but it's clearly considerable. And when we're talking about crime here, we're talking about essentially property crime rather than violent crime, although there clearly is also some violent crime. We had the 40 murders associated with methamphetamine trafficking in Melbourne over the last decade, for example. So there clearly is some violent crime. And an uncomfortable amount of corruption, difficult to quantify, impossible to quantify, but it has been documented in at least 4 royal commissions that I know about, where there are significant amounts of police corruption linked to unsuccessful attempts to enforce the drug laws, documented in the Costigan, Fitzgerald, Wood and Kennedy Royal Commissions. So there's a lot of death, disease, crime and corruption.
And what's our current strategy for dealing with all these harms?
Well, both rhetorically and also in terms of budgetary expenditure, the emphasis is on the criminal justice system. That is to say, across the board, the politicians from all parties emphasise the importance of customs, police, courts and prisons. Not much emphasis on anything else. And in terms of expenditure, in 2002-03, Commonwealth, State and Territory governments spent $3.2 billion responding to illicit drugs. 75% of that went to drug law enforcement, and 10% went to prevention, 7% went to drug treatment, and 1% went to harm reduction.
Do you see a connection between the harm experienced by Australians and this tough on drug strategy?
Yes, I do. I think that the politicians and the community have set up a system with very ambitious expectations which can't be met and which make the problem worse. The scale of the drug trade is so vast that it's impossible for drug law enforcement to have much impact on that. And Mick Palmer is one of a number of people who says that, and he has...
Former head of the Australian Federal Police.
Yes, and he has considerable, of course, experience in this area. I don't have. But that's in line with international views now on that matter. And really the return on investment, if we're looking at this from a business perspective, the return on investment from spending on customs, police, courts and prisons is very difficult to identify. It's very easy to find a lot of serious negative consequences from that investment. In contrast, the investment in health and social measures, very much smaller. It's easy to document the benefits, and the disbenefits, the negatives, are fairly minor in the scheme of things.